A new study from Curtin University is offering a hopeful and highly encouraging look at how our simplest daily actions, like chatting with a friend, walking through nature, or challenging our minds, can have a surprisingly powerful effect on our mental well-being. In a world where mental health is often framed through the lens of treatment or crisis management, this research brings a breath of fresh air, showing that prevention can be just as impactful and that well-being may be far more accessible than many people assume. What makes these findings so compelling is how universally achievable the recommended actions are. We're not talking about expensive therapy sessions, elaborate wellness retreats, or complicated regimens. The behaviors that showed the greatest mental health benefits, talking regularly with others, spending time outdoors, being mentally engaged, practicing spirituality, helping others, and staying physically active, are things that many people can begin incorporating into their lives right away. These are not luxuries reserved for the few, but opportunities for nearly everyone to improve their emotional landscape without needing to upend their daily routines. Social connection emerged as the most striking factor. Those who engaged in conversations daily scored a full 10 points higher on a standard mental well-being scale compared to those who connected socially less than once a week. That's not a small difference. It speaks volumes about our intrinsic need for connection. Humans are deeply social creatures, and even a brief, friendly chat, a check-in with a coworker, a call with a friend, or a conversation at the coffee shop can have a ripple effect on our psychological resilience. These interactions are not just pleasant distractions. They are foundational to how we feel about ourselves and our place in the world. Spending time in nature was another behavior linked with notable gains in mental health. Just being outdoors each day led to a 5-point improvement in well-being scores. This is consistent with a growing body of research showing that natural environments calm the nervous system, reduce stress hormones, and promote a sense of groundedness. Whether it's a morning walk through a park, sitting under a tree, or simply stepping outside for a few deep breaths, the natural world offers a kind of quiet medicine, gentle, accessible, and profoundly restorative. Mentally stimulating activities were also strongly correlated with improved well-being. These could include anything from solving puzzles and reading to learning a new language or skill. Engaging the mind in this way keeps the brain agile, boosts confidence, and provides a sense of accomplishment and purpose. At a time when many people feel overstimulated yet mentally unfulfilled, rediscovering the joy of focused mental activity can offer a unique and lasting sense of satisfaction. It's not just about staying busy, it's about staying meaningfully engaged. Even more encouraging is the broader implication of these findings. They support a shift toward a preventative, proactive model of mental health that doesn't wait for a crisis to intervene. Instead, this approach emphasizes the ongoing cultivation of mental well-being as a natural part of everyday life. It reframes the conversation around mental health from something clinical and reactive to something everyone can take part in, joyfully, creatively, and with ease. What makes this study particularly timely is that it was conducted during the COVID-19 pandemic, a period of global stress, isolation, and uncertainty. Despite these challenges, 93% of respondents reported no psychological distress, and mental health scores were in line with pre-pandemic international averages. This resilience is remarkable and suggests that, even amid adversity, people who maintain positive daily behaviors can buffer themselves from the full impact of external stressors. It demonstrates the strength of the human spirit when supported by consistent, nourishing habits. The implications for public health policy are profound. Rather than relying solely on costly interventions for those already in crisis, health campaigns could be expanded to promote simple, evidence-based behaviors that help people stay well in the first place. Professor Christina Pollard, lead author of the study, emphasized that these aren't interventions that require extensive resources. They are everyday behaviors that can be encouraged through public messaging and community support. They're habits that can be taught in schools, promoted in workplaces, and modeled in families. The Act Belong Commit campaign, which the study evaluated, does just that, encouraging people to stay mentally healthy through connection, meaningful activity, and helping others. With 86% of participants recognizing the campaign and nearly universal agreement that mental health should be prioritized as much as physical health, there is clear public appetite for this kind of positive, preventive approach. Ultimately, this study serves as a reminder that mental health isn't something that happens apart from daily life. It is daily life. The walk you take in the morning, the friend you text during your break, the book you pick up at night, the stranger you smile at on the bus. These moments may seem small, but they add up in powerful ways. They form the threads of resilience, belonging, and purpose that hold us steady through both joy and difficulty. So, as we look forward to brighter days, we might begin to view well-being not as something elusive or out of reach, but as something we can actively cultivate, bit by bit, day by day. And the beauty is, it doesn't take monumental effort. Just a chat, a step outside, a moment of learning, or a gesture of kindness. These are the things that keep us whole,